A major opportunity that is emerging for some that are keen on doing business is one that involves provision of social services. Now, there are those that have gone into education, while others have gone into health service provision. So today, we want to know what it means to occupy this unique position as an entrepreneur, but also a provider of social services. Take a look.
We're almost making 10 years of service. We started in 2015 in 2 rooms which we were renting, and after like a month we were told to vacate. We got some simple building which we renovated, but the space was not enough. We used to admit patients under the bed. However, during that period they were doing the Chisoga Katosi Road project. We got the waste soil and money to make bricks and set off the foundation. Today we have 50 hospital beds, and we're a 50-bed capacity hospital with a theater, with a lab, a dental clinic, radiology department, a very good eye clinic, and so on. So like our motto, we serve the community regardless. The people we serve get less than $3 a day, and these are farmers who do subsistence farming. They get less, but we always try our best to serve them with the little they have. Every year we deliver between 400 to 600 mothers. That is as per the report from Ministry of Health, because we report through the DHIS2 reporting system. And we do around 250 cesarean sections. But you find that our Caesar is deliveries, mothers pay like $5, but still some run away without paying, so they have nothing at all. Because our community is basically made up of people who, unless many have non-communicable diseases, they have diabetes that's not treated, they have ulcers, they have a number of illnesses that are painless, but usually these kill many. So we last did the camp in 2020 because of COVID-19. It really made a big impact on our service. We couldn't offer anything. So we are trying to wake up from the COVID strain and pandemic. So we decided to make this camp to reach out to people, the elderly, the children, to give them at least some hope of life. And we've got so many partners who have helped us. One Project Foundation, we've worked with Lions Club Mokono, we've worked with IME 2000. Many have helped us and the staffs. We've reached out to over 2,000 patients in these 2 days. And we've topped up that day by doing 20 cataract surgeries, which are free. You can't imagine a patient walking into the hospital with diseases that are not known and getting diagnosed, getting treatment, and walking out. Today, drugs are very expensive. There are so many taxes. So it's a great impact to the community, because many came with ulcers, many came with hypertension, many have diabetes, but they have got medicine. We always want to have medical camps, but we don't have support. Otherwise, we would have, like every quarter, we would have medical camps, because a number of our people do not have the money and access to medicines. And sometimes you find there are government facilities, but of course drugs are not easy. Even in government, it's hard to stock hospitals. The biggest challenges we face is we run a budget of $40,000 to equip the pharmacy. So it's very hard to buy drugs, to pay the staff salaries, and also the community perception. Some people were like, we need to use the herbalists to treat our ulcers, we need to smoke the pipes. Maybe the region doesn't want us to go to have a blood transfusion. So sometimes we have the negative perception of people. If you test someone HIV and it's like, I'll take my herbs. We would like partners that if they can help us with staff infrastructure, we are trying to make a project where we have a plan of building staff houses, staff quarters. We need to complete the phase 4 of the hospital, which would have the theater, the intensive care unit. When the students who got burnt were brought to the hospital, we had no ICU, so we couldn't accommodate them and refer them in town. There was jam, so we hope to at least have the ICU so that in case such tragedy happens again, we're able to save lives. That time we lost over 12 children in the fire. So we want to have a better ICU, a better theater. We need to have staff sleeping well, at least near the hospital, and also getting a better pay.
This is a general medical camp that we always do every year, and it is basically made to see that we give back to the community, because we live in a community where people are very poor, so some of the services here people cannot manage. So what we do every year, we arrange something of this kind so that we can give back to the community. And all the services that we give range from the lab tests, the consultation, everything is free. Besides the general medical camps that we organize, we also offer free services like immunization of babies. It is free. And we also conduct what we call outreaches. In outreaches, we move to villages using the ambulances that we have and give free services to the people, free HIV testing and counseling, free drugs, free eye checkups, and free treatment to the old and the less privileged, like the